sometimes showing that I care is really much more powerful than any pill that I can prescribe.
And that's really nice to know that somebody cares personally about you.
If I have questions or things I would like them to check on, it gets done. They report it back to me that same day.
This is a visionary model of where healthcare is heading.
I am very well at ease about it. I don't worry anymore.
When we put this company together and designed it, we designed it to eliminate the communication issues, completely eliminate the transportation issues, build it on a very user-friendly relationship with the facility and staff.
When Advantage Wellness comes into a facility and provides a nurse practitioner who comes directly to the facility, they actually get a higher level of medical care than they would get otherwise.
There are many advantages of this delivery system. Number one, of course, is on-site care. A senior who is failing, particularly who is having a number of issues in their environment, is best seen in their environment.
This is a special population with special needs. There's the dementia patients that encompasses a large part of the population at assisted living facilities that I visit.
Here the nurse practitioners can come into the dementia care unit and actually even follow the resident down the hallway as they wander sometimes, just to get a good idea of what's going on with that particular resident. It's a wonderful way to take care of people here.
I think just the fact that someone comes and sees her is a positive, because she's almost 91. She likes the attention.
Okay, ready? Here we go. It's going to get tight. I want to get good reading on you.
It's definitely a different kind of medicine. Even when I took care of geriatrics patients who were in the community, who were 50 and 60 years old, this is way different. The goals are different, and the approaches are different.
That mindset of having a nursing background makes it a little bit different in regards to the approach to the patient, which is very much needed.
I think it makes a big difference to know that I did care. I've had patients, families tell me that. I know you care about my dad, and that's really important.
I feel like I'm getting better quality because I think she takes more of an interest, knowing that she'll see me twice a week or can see me. But I think she gets to know people as myself on a one-to-one basis, which is always nice.
I see these patients, some of them every week, and you get to know them and their personalities and their quirks, and you just can't help but love them for it.
Several of the 15 years that I have spent in the senior living industry, I had the privilege and pleasure of running a very large life care community in north central Florida. The whole issue of continuing to maintain medical care outside of my facility became a huge challenge.
The residents themselves have a difficult time getting out in the community to physicians' offices, so having someone come to the building is amazing.
You know, how am I going to get her at this doctor? How am I going to get her at that doctor? You know, nobody can come here to help with her. Taking her out with a wheelchair is very, very difficult. So it's given me some sort of my life back also. Yeah.
We're gonna have a little stick here, okay? Okay. You're gonna be a little sore, probably not till tomorrow, okay?
Okay. Thank you.
You know, when you come to an office, you get all dressed up, you're bathed, your hair's done. That's one picture of how you're doing. But when I go to the facility, I can tell that they're, if they're not, groomed well, or if they're not coming out of their rooms. I even go into the dining room and observe patients, seeing how they're eating, seeing who they're conversing with. I go to the activity room and see who's participating, and that gives me a whole lot more information than the cleaned up version of coming into the office.
The number one thing that can't happen to them is for them to literally be forgotten.
Yes. Okay, can I have this leg, please? It's you. Oh, yes. And this is the one that usually hurts you.
And of course, if Terry finds there's something that she can't possibly take care of, she's first in line to say, or refer a doctor to take care of that.
AWS knows when they've reached their limit and refer out to other physicians. So that's a marvelous thing as well.
When I was in private practice, the patients that would come from the assisted living facilities, it was hard on them. And the people that brought them didn't necessarily know really what was going on. Even if it was a family member, they weren't with them day in and day out.
So that's where the transitional care comes in. One person has to be sure that in each step along the way that nothing is lost, and that not only is excellence in healthcare delivered, but the wishes of the patient and the family are also transferred from venue to venue.
As soon as I get that result, I will communicate with you by email. It's very nice seeing you both. Thanks, Lisa.
Communication is the biggest thing. I mean, knowing that if there's an issue, somebody's going to call me, somebody's going to contact me.
You know, there's a comfort zone. You know, that I don't have to concern myself with really being here on site every minute.
It's opened up a wide array of limiting my time on the phone with a family member or my nurse's time on the phone with a family member.
At least in the areas that we've gone into, we really haven't encountered by any other medical groups that are doing what we're doing, is the electronic medical records, which is a web-based system which allows not only the medical professionals in the facilities to have access to everything that we're doing, including lab results, x-rays, recent nursing notes.
The electronic medical record that we use actually is more complete than what many of the facilities have in paper.
Assuming it's okay with the patient, we also give access through a password and a PIN number to their guardian, their daughter, their all of their children if they want us to. We, of course, are a freestanding corporation. We have our own professional liability insurance. All of our clinicians are covered by us.
They've adjusted their schedules to accommodate our schedules here as far as nursing. So it's worked very well.
There's no exposure really to the facility at all. So they feel comfortable bringing in a service like us as opposed to trying to do it themselves. I would never, unless I'm proven otherwise, say that someone can't provide the same care we do. But I think all of the other advantages of Advantage Wellness Services is really kind of what separates us and then ultimately separates that community, that facility, from their competition.
I always request that they send you a copy.
I have yet to have let's say a patient of mine that I have transferred to AWS, that a month later the family doesn't call me up and say, thank you. This has really made our life easier.
The Advantage Wellness it's remarkable. It's remarkable. I had no idea any of this happened either until I brought my mom here.